Good afternoon, everyone.
Yeah, good afternoon to you too.
I am Ravi Gupta. I am editor-in-chief of eHealth magazine. I am also the founder and CEO of Elets Technomedia Private Limited. Today, we are having the honor of having Shri A.L Hek, who is the Honorable Health Minister, Government of Meghalaya, with us. Welcome, sir, on this webinar.
Thank you very much. I'm Mr. A.L Hek, Health Minister, Health and Family Welfare Minister, Government of Meghalaya. Nice talking to you, Dr. Gupta ji.
Thanks for joining in. Just to inform everyone that we are live on Facebook, and thousands of followers of eHealth and eGov and Elets are watching us. And we all are aware that what is the situation of COVID-19 globally and in India. And we are seeing the rising number of cases daily from all states of India. So in this situation, we are today having an interaction with Shri A.L Hek, Honorable Health Minister, Government of Meghalaya, about preparedness for COVID-19 in each state. So to start with, I am going to ask you that what is the current situation of preparedness regarding COVID-19 in your state?
In Meghalaya, right,
Yes.
from the
Yes.
Honorable Chief Minister, right up to the last mile, everybody are ready to fight for the COVID-19 in our states. Everybody are working very hard. They are working day and night. They are fully prepared for any eventuality or any situation to combat with the COVID-19.
So, how is the how many patients we have with the symptoms right now, sir, in the state?
The patient with the symptoms. Okay, now we have like this, the number of samples sent for testing till April, 18 April 2020 is 738. Number of person tested negative till yesterday, it was 721. Number of person tested positive till yesterday, 1 disease, one night. Number of the test result awaited till yesterday, it was 60. Number of person out of quarantine till 13 April 2020 is 7,037. Home quarantines from 14 to 18 April is 3,430. Institutional quarantine till 18 April is 121. So I have made number of phone calls received through helplines is 49,391. 49,391. Number of persons contacted through IVRS till 17 April is 20,563. So contact tracing details till April 2020, the primary contacts is 189 and the secondary contact is 4,755.
Thanks for the info. Sir, as we are seeing that the number of patients with the COVID-19 symptoms is increasing in your state also.
Right.
So in this situation, how are the hospitals and other healthcare units in this state gearing up to tackle the COVID-19 situation?
The hospital, we have already converted 2 hospitals into COVID-19 hospital. That is one in Shillong Civil Hospital, where are ready for 300 beds. and also for Tura Civil Hospital, which is ready for 100 beds. And we are now prepared for 10,000 patients in all the hospital in Shillong. That is preparedness is going on.
Great. Sir, how is Meghalaya dealing with the lockdown situation? And are there any specific policy or guidelines being passed in the state for controlling of COVID-19 cases? And
Following the national health guideline of the government of India.
And according to you, what are the preparation in each of the district for control and stopping the spread of this virus?
We have already locked down completely the whole state of Meghalaya. We not allowed any enter districts. We don't allow any enter states. Everything has been locked down for some time till the lockdown periods. The preparedness with all the districts. The district, we have 11 districts in our state of Meghalaya, and we have 13 Corona Care Center in all the districts. We have about maybe 14 quarantines places are present, and also we are exploring more quarantine places in our states.
Great. And what is the status of PPE and ventilators in the states? The equipments.
Equipment is here talking about the PPE. We have at present 44,403. Ventilators, we have 59, including private and public hospitals. We have the BiPAP machines, 60. As far as the rapid test kits are concerned, we have around 4,000 rapid testing kits. These are the preparation from the equipment parts we have at the materials. Yeah.
And are there enough doctors in the hospitals? Like, are the doctors there?
At this juncture, I'm not just make a tall clip that's saying we have enough doctor, but we are prepared and have, yes, of course, we have almost we have 8 doctors and 26 nurses also deployed recently in the different PHCs. And we have also already given appointment for 15 lab technicians and also 9 OT technicians. And also we have appointed so many manpower to meet the requirement at this juncture.
And do you have private hospitals in your states who are also supporting government in this initiative?
All the 8 private hospitals, all of them are supporting to fight together for this coronavirus disease.
And how are you ensuring the availability of food in lockdown situation?
We are from the government side, from the administrations, all the quarantine center, corona care center, even the hospital, all the foods are been providing from the state government, from the administration and all the different districts.
And how this situation, the COVID-19 situation, has impacted agriculture and supply chain of vegetables and food grains? And how are the farmers affected with this?
Of course, we have no issue with the farmers at present. They're still going back to their own farming job. And the vegetables and other essential commodity are during the lockdown period. We have been managed well still till today in our states.
And sir, how is the situation for doorstep delivery of services?
Doorstep delivery, we have here in Meghalaya this traditional institutions. You know about the traditional institution is also like the panchayat.
Yeah.
See, panchayats through the government, through the local representative, through the heads of the traditional institutions, everybody, they are doing the doorstep distributions to all the districts.
Sir, this is a big health crisis situation.
Right.
So in this, how is the various departments of government, how like your agriculture department, your rural development department, urban department, water department, there are like so many other departments, how each department is helping to support in this crisis?
Every department actively involved on supporting to fight for this coronavirus in our state with the government. Each department. You talk about the food and supplies department, they're taking care of the essential commodities. You talk about the PHE department, they're taking care with all the water supply and everywhere. And also you talk about the urban affairs, how to sanitize the entire states, the entire cities, and also in the rural areas. All the departments are involved here, right from the deputy commissioner, the police superintendents, everybody are involved together and taking the collective responsibility to fight the coronavirus in our states.
Great. And what is the situation in terms of the people who already have been detected with the corona? What is the situation of their quarantine, and seeing to it that they don't mix with anyone else? So are there any
had been isolations, been isolated, they are staying, or all had been given the center which is taken care very well to these positive patients.
Mhm. And are you looking at taking care of the mental health of the patients? Because
Yes,
everywhere.
mental health of patient also have been taken care. Even those who have been stranded during this lockdown period. Suppose now people are the students coming from outside the states.
Yes.
Even the migrant laborers,
Mm.
those are coming outside from the state. Those who got stranded during the lockdown period. The government, we not believe our state government has taken responsibility to all of them, those are stranded here, all the hospitalizations, any kind of treatment, any kind of food, essential commodities are being taken care by the state government.
Excellent. And sir, this situation of migrant laborers, like they are returning in this situation to their own state or their own villages. So are you allowing them to enter the state, or are you not allowing them?
Not allowing during this lockdown period, not even in the district, not in the state, we are not allowing anybody now. Those are our students also now stranded outside the state. It has to be remain there till the lockdown period has not been change the notifications.
Okay. And sir, those people who are stranded and trying to come back, like there are a lot of northeast population
Students,
which are there in Karnataka and Hyderabad and several other states. So is the state government trying to looking at helping them in other states?
Recently, wherever we have already registered with our state government with their account number, we have already sent 3,000 each to every student, those not only student, anybody who's belong from the Meghalaya, those are studied outside the state of Meghalaya. We are sending the first. We already sent 3,000 rupees each to all of them.
Okay. And sir, someone is asking that on the screen that since Meghalaya the cases have increased, is there a plan to convert hotels into the isolation wards?
We already requisitioned so many hotels to convert them into the isolation wards and quarantine wards. Yeah.
Okay. And someone is asking about the are you also looking at any work on the air quality since this situation?
We are if you know about the state of Meghalaya, is a pollution-free states. So we don't
Yeah.
have any issue with the air quality in our states. It's a pollution-free states.
Yeah. Yes. Yes. And someone has asked, is there a plan for health insurance of health workers in the
Right.
COVID-19?
See, for Meghalaya, we already have the insurance scheme which we call health scheme, which is called Mega Health Insurance Scheme.
Okay.
Mega insurance scheme, which is covered to all the citizens of Meghalaya. All the citizens of Meghalaya is covered under the Meghalaya Health Insurance Scheme, where we are paying 5 lakh rupees to every every household in the state of Meghalaya. But during this lockdown period, even those people, which I have already told you, those are from outside Meghalaya, which are not entitled for the Mega Health Insurance Scheme. They are not entitled for any kind of free treatment, free hospitalizations in Meghalaya. Even then, them also, during this lockdown period, Meghalaya government has already declared everybody who are fell ill, who need the hospitalization, who need the treatment in all the hospital, whether it is the government hospital or is a private hospital, every cost will be borne by the state government.
Sir, there is a question by Mahesh. He's asking that there are a lot of people from Tamil Nadu and Kerala and laborers from Bihar who are working in Meghalaya. So are they being taken care of?
All of them, not a single one will be left out. Not a single one will be left out. Everybody, whether it is from anywhere, maybe it is from outside India also. If they are locked down here during the standard here, during the lockdown period, everybody has been taken care as us, our own citizen, our own family.
So, are you ensuring that these migrant laborers who are in Meghalaya right now and the poor people, are they getting food daily to eat and to survive?
They're getting right from the breakfast, the lunch, the dinner. Everybody has been made arrangement to everyone.
Fantastic. Sir, the Ministry of Home has issued some guidelines for relaxation of some of the services from the lockdown in the non-red zones where there are less number of cases or there are 0 cases. So in some parts of Meghalaya where there the cases are 0, are you going to give some relaxation to someone?
That relaxation will be there, but partial relaxation, not the complete relaxation. Partial relaxation, like the farmers, they can go back to their farm, to their work. Then, like the daily laborers, they can only those people who are stranded here only. Suppose those people coming from outside also, those are stranded here in Meghalaya, the migrant laborers, even them also we are allowed to go to work. Okay, all the daily wages, the domestic workers, everybody will allow to work only on the partial relaxations.
Okay, fantastic. Sir, what is your message to the public in this crisis situation? How are they supposed to deal with it?
My message to public is, number one is we have to be adhering with the advisory of the health protocol, number one. Everybody are advised to stay home only, stay safe and stay home, and they should maintain the social distancing. This is the priority which is advisory given from the health protocol, and everybody we appeal to follow also the WHO health protocol.
Sir, we at Elets are trying to create awareness about corona situation and create awareness that what is all government doing in this sector. What's your message to all our audience who are and how do you see our efforts, and if you have any suggestions for us, for an organization like us too?
Number one is they should not be panic.
Yes.
Okay. People unnecessarily they are panic. This is not required to be panic because this disease is a curable disease. It is only the self-discipline. If you have a mild symptom, that also is not required medicines. You don't require any treatment. Only the self-discipline, it can be cured by themselves. If we are not self-disciplined, that is, we have nothing to say, but my appeal is just to be a self-discipline, stay at home and don't have any kind of stigmatized. No stigmatized to be allowed to anyone. Otherwise, unnecessary, it'll be panic. It's not required to be panic at this time, I'm telling you.
Right. So with this, we can end this webinar here. I think I have asked all the questions, and audience questions also you have answered. And thank you so much, Shri A.L Hek, for joining us here. And I'm so happy to see that you are so much dedicated, and you are working so hard for the battling the COVID-19 situation in your state, right? So namaskar and बहुत धन्यवाद आने के लिए.
Dhanyavad, and thank you very much. Stay safe, stay at home.
Thank you. Thank you.